Hello, everyone, and thanks for being with us today and enjoying the great content put together by Trio Maryland. I'm Rachel McFadden, as some of you have seen from previous sessions, and I'll be moderating today. Our last session is Foundations of Medical Cannabis. Is it right for me? And please remember that you can post your questions in the Q&A tab, and we'll share those at the end with the speaker as time allows. We're excited to have Tracy Lancaster Miller, Executive Vice President of Peak Relief Cannabis Dispensary. So please welcome Tracy.
Hi, thank you so much for having me, and it's a pleasure to be back with the Trio community. I'm gonna share my screen here so that we can see my slides. So I am a founder of Peak Relief, as was mentioned, and we are a medical cannabis dispensary in Maryland, and specifically in Rockville. We've been open for just over 6 years now, and that's how long the medical cannabis program has been running in the state of Maryland. I know that there are individuals here from other states, so I'm going to make sure to try to keep the conversation open for what you might be able to expect in your state. But this slide here, I want to make sure that you all see. This does have my email on here, and I'll have my email again at the end. And I would really encourage anyone who has questions that may not be answered here or that you might want to reach out to me more privately about, please feel free to reach out to me directly. I can help to get you information about specifically the state that you are in and other types of questions. So my role at the store, I just want to make sure everybody knows I am not a medical professional. I have resources where if you have very specific medical questions, I can direct you to medical professionals who will be able to help you. For instance, at our store, we have a clinical director. She is a nurse with many years of experience with cannabis and cannabis products and knowing how cannabis interacts with different types of pharmaceuticals and different conditions. So we're going to talk very basically about some things today, but for those more specific questions, I will direct you to her and other people like her. What I do at the store, I do lots of work around government affairs, legislation, regulation, and I am very involved in compliance. So that's definitely the main hat that I wear. And so that's kind of where everything that we're going to talk about today is kind of where all my intersecting things kind of come into place here. So let's jump in and talk about what kinds of conditions could be treated by cannabis. There are a whole range of conditions or symptoms that may be able to be helped by using medical cannabis. And we're going to go into some specifics about what exactly it is about the medical cannabis that may be able to help with specific types of conditions or some different symptoms that individuals may be experiencing. But overall, you can see from this slide that there are a wide range of different conditions and symptoms that cannabis might be able to help treat. I think that it's important to note that cannabis is not right for everybody and for every condition. So depending on your individual experience, it is very important to talk to somebody who is knowledgeable about cannabis and knowledgeable about your conditions to make sure that you're making informed decisions for your care. Some of the examples of conditions that can be helped with cannabis tend to be things like anxiety, depression. You'll see chronic and severe pain. That is a condition that nearly every medical cannabis program across the country that has one, they will name certain conditions that you can get a medical cannabis card for. Chronic and severe pain is always included. It is a very effective pain treatment. It can help with insomnia and other types of sleep disorders. So using a variety of different methods can help you fall asleep and stay asleep. It can help with muscle spasms and tremors. or other types of uncontrolled muscle movements. Can help with different types of GI conditions, different types of gut health and conditions that a person may be experiencing, including nausea and vomiting that may be related to a specific condition. Very commonly in the literature, this is talked about with chemotherapy and other types of cancer treatments, but also nausea and vomiting as a result of other types of conditions as well. It's been shown to be good for diabetes, multiple sclerosis, fibromyalgia, migraines, and also PTSD. But what is important to note, as I said before, is that cannabis, while it can help many people with a wide range of conditions, it is not right for everybody. So it is important to be cautious and to consult with your medical professional, especially if you have heart conditions, including high blood pressure. This relates to certain aspects of cannabis can increase heart rate. And so if that could be an issue with a specific condition that you have, it's very important to make sure you talk to a medical professional and decide if it's right for you. Generally speaking, side effects with using medical cannabis therapies are very mild. However, occasional side effects can be more severe. So it's very important to know kind of what to be expecting if you are going to be consuming medical cannabis. Most common side effects that a person may experience will be disorientation. May also experience euphoria. This is sometimes the high that someone may say that they want to avoid, and there is also red eyes, dizziness, and racing heart. And that racing heart is directly related to what I was saying before about how certain cannabinoids can increase heart rate. So while you may hear the term in the literature about some of these side effects being more severe, most of the time the side effects will not be causing, damage, but they can be scary. Being incredibly disoriented can be very scary. And if there's a person who's at risk of falls, disorientation can be very bad and can decrease quality of life. So these are all the things that have to be weighed when determining, is cannabis right for me? If it is, what doses am I going to be taking, and what specific pieces of this therapy am I going to be using? So it's also always important to speak with a medical professional about drug interactions. In states like Maryland, the dispensaries where you would be purchasing medicine, these dispensaries have very strict regulations about training. Staff have to be trained on many different items. So you can get a good amount of very basic information from those dispensaries. And also in Maryland, all of these dispensaries are required to have a clinical director. Like I said, we have a clinical director who is a nurse, and you will find that all the other dispensaries have a similar medical professional, whether they be a doctor or a pharmacist or a nurse or nurse practitioner, who they may be there virtually or they may be there in person, where they can talk to you in a little bit more depth about, the specific medications that you may be on and how those could be interacted with the various components that are found within the cannabis plant. And we will get to those components here in just a moment. So as we're thinking through if cannabis is right for me, if it's something that I'm going to try, I think that most people will generally think of smoking or vaping, what we call on here on this slide of routes of administration, inhalation. And yes, that is an option, and many people do. And there are also many other routes of administration that within a legal cannabis market, whether you have medical in your state or whether you have medical and adult use or recreational, which is 21 plus, you have access to nearly all of these types of routes of administration in your state. So there is oral administration. So this is just like any other prescriptions that you may be taking This would be a pill or a tablet that you would take, maybe a capsule that then you would swallow, and this would be digested within your system. It can take 1 to 4 hours, depending on your personal metabolism and other factors like whether you have any food in your stomach to help absorb the cannabis. And it is long lasting. So it can last anywhere you can feel the effects of it for anywhere from 6 to 12 hours, for example. So oral administration, and you may see in some states like gummies and lozenges and things like that, oral administration is really good for long lasting. We can also administer sublingually. So there are specific tablets or tinctures that are made that you can, and that's what this picture here is, you can administer sublingually. So what you'll want to do there is you would place it under the tongue where you have the large vein, and you would let the sublingual tablet or the tincture, you would let it sit there under the vein so that it can be absorbed through the vein. And so we're not swallowing it in this case so that it is going through the digestive system. In this case, we're allowing it to be absorbed by the veins in the tongue. And what this does is it allows it to get into the bloodstream faster. So instead of waiting 1 to 4 hours like you may have to do with the oral administration, you're having a basically more instantaneous effect. It may only take a few minutes for those cannabinoids to get into your system and for you to be able to begin to feel the effects of this. And because of this, the effects don't last quite as long as eating it orally. They'll last, a handful of hours. And everybody's a little different, and it does depend on what dose that you are taking sublingually. But I think that is a really great alternative to smoking and vaping if smoking and vaping is something that you are not trying to do. Because one of the benefits that people talk about with smoking and vaping is that it has the quick onset. So you can get the same quick onset from sublingual as you do with smoking and vaping. So it is a really great alternative to think about. In addition to that, there are topical or transdermal applications, which we have the picture here of this cannabis salve on the edge here. So these are products like lotions, balms, patches, things like that that are administered onto the skin that are then absorbed into the skin. And in addition, there are also suppositories that can be used rectally or vaginally that are also really great at absorbing into the body. That can be really great for people who are experiencing really extreme nausea and vomiting, or having GI issues and are unable to keep medicines down. Those are really great routes of administration. So we've thought about what kinds of conditions cannabis may be able to help. We've thought about things that we should consider in terms of side effects and how we may be able to consume cannabis the many different ways. Now we're going to talk about cannabinoids. So cannabinoids are essentially just the ingredients that you have within cannabis. I think most people are most familiar with THC. This is the cannabinoid that you will sometimes hear referred to as Delta 9 THC. And this does cause that euphoric or that high that some people may not want and other people may, depending on what they're treating for. Every single cannabinoid has very big medicinal properties. There's lots of therapeutic value in all of them. So I think that sometimes when individuals are first getting familiar with medical cannabis, they may say, THC is, there's no medical value for THC, but the other cannabinoids have medical value. It's actually not true. All of them have medical value, and it really just depends on what conditions or symptoms do you have, what are you trying to treat, and how can we get the best quality of life for you from this therapy options that we have. So Delta-9 THC can be really great for pain, and I think that that's what most people know it for. It is really great for chronic and severe pain. In addition to that, it is an appetite stimulant, really can help with nausea and vomiting. And when applied at the appropriate dose for an individual, and this is going to be based a good bit on your personal tolerance, it can help with sleep as well. And it's been shown to be good for individuals with PTSD. And there are many other cannabinoids that are out there. Below THC, I have two other cannabinoids listed here, CBN and THCV. The reason that I have these all together is because they are all what's known as either psychoactive, which is what Delta-9 THC is, or mildly psychoactive, which is what CBN and THCV are. So these are the three cannabinoids, the three major ones that you should be aware of. If you're consuming, there is that potential for that euphoric sensation, a little bit of that disorientation. So you should decide and, talk to your bud tender, and we will have a slide later where we have specific questions that I would recommend you asking of your bud tender about, are these cannabinoids right for me? CBN is a really great cannabinoid. It's best known to help with sleep, to really help with insomnia. It is what's known as kind of a muscle relaxant, and so it really helps the muscles in the body to loosen. And it does provide a little bit of that, what some people may refer to as a couch lock effect. So that's really great for individuals with a lot of pain and who may be experiencing severe sleep issues. On the flip side of that, if that's not something that you're experiencing, this is maybe a cannabinoid to stay away from if you're looking for something that you can potentially go about your day-to-day while you're using. But CBN is also good for muscle spasms. And the last one on this side is THCV, which is best known for regulating blood sugar and suppressing appetite. And so you can see that THCV actually works opposite of THC. So while THC is that appetite stimulant, THCV is suppressing that appetite. So I think that some people assume that when consuming cannabis, you will get the munchies, and that is not true. There are a ton of factors that go into that. And if that is a concern that you in particular have, that's a conversation that you should have with the bud tender so that they can make sure that you have different cannabinoids that can help make sure that you have the best experience possible. On the other side of this slide, we have our non-psychoactive cannabinoids. CBD is probably the best known non-psychoactive cannabinoid, so you're not going to have any of that disorientation or euphoric effect. CBD is also known to be really great for pain. I think that many of us have seen the many documentaries that are out there that talk about how good CBD can be for different types of seizure conditions. And in addition to that, it's very good for anxiety and depression. CBG is another cannabinoid, and I think that this one is best known to help with GI conditions. So in the state of Maryland, most of the edible products that have CBG in them say something about gut health, something about, helping with the stomach. There has been shown to be some anti-tumoral properties with CBG, and I do bring that one up on the slide because it does come up in questions and answers sometimes. I think what's very important here is that those studies have been done on, they are animal studies, and they have not been done on humans. And so there is a very big jump between animal studies and human studies. And so while there are exciting research out there, it's very important not to say that cannabis could cure cancer or shrink tumors or anything like that. However, what we can say is that many of these cannabinoids have been shown in double-blind clinical trials to help individuals with symptoms when they are experiencing cancer and cancer treatments. CBC is another non-psychoactive cannabinoid on here. CBC is best known for reducing pain. And that's actually because of the receptors in the body that it interacts with. And it is a great anti-inflammatory, helping to reduce swelling. And lastly, THCA, another non-psychoactive cannabinoid. It is an appetite stimulant. So let's say that you are seeking a daytime option where you can go about your day-to-day without psychoactivity, but you are seeking appetite stimulation. THCA is a really great option. THCA has also been shown to be a neuroprotectant, so has been shown to be helpful for individuals with certain types of conditions like Parkinson's. So next up, I think when we are talking about medical cannabis, it's important to talk about testing and labeling, because once we start to learn what is it, what types of ingredients, the cannabinoids should I be looking for, how might I want to take it, what should I watch out for with my personal medical history, it's important to know with the state that you're in, what are the testing? And if you have a state legal program, whether it is a medical program or a medical and adult use program, you have testing standards. I can speak specifically on this page here. We're going to talk about Maryland. Most states have very similar testing, and I would be happy to, if you want to reach out to me after this, we could go into some details if you tell me what state you're in, and I can tell you what the testing is like. But I'm just showing you an example here of broken out parts of what's known as a certificate of analysis. You should be able to access a certificate of analysis for the medical cannabis products that you are purchasing. Now, this particular one, this is for flower. So there's going to be certain things on here that would be different looking than if this was a processed product. But generally speaking, these are all the things that you can expect to see in a certificate of analysis. You are going to see the cannabinoid content. So this is how you know what is actually in there, how much THC is in there, how much CBD is in there, what other cannabinoids are in there, if any. And like I said, this is a flower product. These are buds that generally people would be smoking. So there is primarily THC and THCA in this, which is not surprising with flower, though you can find one-to-one ratios of THC and CBD flower as well. Many states, but not all states, are also going to have a breakdown of terpenes. Terpenes are not anything that I get into in this presentation specifically, but terpenes are another, we can call them ingredient in the cannabis plant, and each of these items do have therapeutic benefits. And so asking your bud tender about those, I would highly encourage you to, if you are going to be consuming products that have terpenes in them. Also, in addition to the potency testing, which is what we call the cannabinoid and the terpene testing, there are other types of testing that all products have to undergo. So I think for, specifically the conversations that I tend to have with the Trio community, I think that these next ones are the most important. So these products are tested for pesticides. There are pesticides that are not allowed in every state. Every state has very specific allowed pesticides lists that make sure that there are not harmful chemicals that are getting passed onto the products that you would then be consuming. In addition to that, heavy metals are tested for. This is very important because of the nature of the cannabis plant, how it grows. I don't know the technical term, though a horticulturalist could, but cannabis plants tend to uptake things from the soil around them. And so they do tend to, like if there was pollutants in the ground around them, they would uptake them into the plant. And so that is why it's important that heavy metals are tested for. And there are things that are tested for like mycotoxins, microbials, water activity, moisture content. These are all things that are making sure that there are no funguses or other types of microbes that would be in the plant that would be harmful to an individual. We're testing for foreign matter to make sure that there's nothing that's gotten on this or in this throughout the life cycle of creating this product. And you're going to see there's two things on this, the vitamin E acetate and solvents, that it says not required. That's specifically because this is flour and that is for a processed product. Those types of things don't come in until you've been going through a process of turning one product into another. But other types of products like edible do have solvent testing and vitamin E acetate testing. Now this, most COAs will have some kind of QR code where you can get a little bit more information. So this is what like a page 2 looks like. Sometimes there's like 4 pages of a COA. They're very detailed, where it'll go in and it'll tell you what exact heavy metals are required to be tested by in my state. So you can see arsenic, cadmium, chromium, mercury, lead. It'll tell you what the allowable limit is for the parts per million. It'll show you how much, if it tested below a measurable recorded level. That's basically what this is saying here, that it passed. Any ones that weren't required to be, they just say not required, though in processed product, those would come up. And so all of these have all the information, you know, microbials, we're testing for salmonella, we're testing for E. coli, we're testing for total yeast and mold and general aerobic microbial content. So this really gives you a lot of information about what specifically are we testing for in this state. Maryland has a very great, one of like the gold standard testing programs for all programs in the US. And there are many states that have very similar or exactly the same testing. So if you're curious about your specific state and you're not in Maryland, again, please reach out to me and we can go into that. There are other consumer safety issues that are really important to be aware of for medical cannabis. When shopping in Maryland, you'll see things like this, storing cannabis safely. You'll see these flyers around posted up in different areas. This is teaching individuals who are using cannabis how to protect your family, how to protect your kids, how to protect your pets. So they're teaching you best practices. So you should always store your cannabis out of sight and out of reach. So most dispensaries will have options for different types of locking containers that you could purchase that then you could store your cannabis in. There's a lot of options online as well. It's definitely the best way to store it if you have children and pets in the home. And they talk about what you should do if there is an accidental consumption by either a child or a pet with numbers. And to get more information, you can scan the QR code. And Maryland has just updated their campaign for, providing information for cannabis, both adult use and medical. And so there's a lot of really great information that you can find at both at dispensaries and then also at the MCA website. Another consumer safety issue to be aware of, and that you will see these posted around at different dispensaries, is not to mix cannabis and driving. Because cannabis can impair your reaction time, slow your reaction time. It can lead to, you can get a DUI for driving under the influence of cannabis. So this is a consumer safety issue to be aware of. And for more information, definitely you can go to the MCA site as well there. You'll also see different QR codes around the dispensaries in Maryland, just at the registers or on different boards or doors. And this is where you can scan the code and just get more information as well. And you're welcome to, scan this code from here as well and take a look at more safe and responsible cannabis consumption tips. So, thinking about now you're at the store, you are seeing that there's all this information around to help you make your decisions, and you have Your bud tender, most of the time that's what people refer to them. Sometimes they'll call them your wellness advisors or a guide for, patient advisor, maybe what they're referred to. But basically, in most states, people refer to them as bud tenders. So here's an example list of questions that I think are good kind of standard questions to ask your bud tender to make sure that you are finding the product that's going to work the best for you and that you are comfortable with making sure that the products have kind of fit all the boxes that you want to make sure. So for instance, are these products third-party tested and verified? If you're shopping in a legal program in a state that has a medical cannabis program or a medical and adult use cannabis program, the answer is going to be yes, but you should ask these questions. These are very important because you may want to see, each of the products is going to have kind of consolidated information on them of, what are the cannabinoids? What are the terpenes? Did it pass testing? But you should, in most states, and definitely in the state of Maryland, you can get access to those very specific certificates of analysis that I showed you on the previous slide. So you should ask, where can I access the COA for this? Another one, very important to make sure that you are participating in the legal regulated market that your state has set up for a cannabis program. You should ask them, is your store's license that was given from the state regulatory authority, is this on display somewhere in the store? They should be able to show you that. In Maryland, they have to. It is generally speaking in the lobby or the waiting area. And then when you're getting to know your bud tender is, maybe asking questions about what types of products you may want to be consuming and just trying to get a feel for how they can best help you. Questions that you can ask them is, if you're a beginner, though you could substitute in any other descriptor here, what products do you recommend for someone who does not want to smoke or vape? This will help them narrow down the options to the edibles, the tinctures, the topicals that they have in the store. Or alternatively, you could ask, what are products that you recommend for a person with my condition? You could go into, some of the things that you may want to be treating for. Or maybe you don't want to share that, and that is totally okay. And bud tenders do know how to make recommendations, even if they don't have very specific information from you about your medical conditions. And so if you know that your condition can be helped with X cannabinoid, maybe CBG, you could say, what products do you have that contain CBG? That'll help your bud tender kind of find the right products for you. And importantly, you want to know how to use the products that you're getting. So how do you know how much to consume? You should ask the bud tender that and ask them, how do I use this product? And what are the effects that I can expect from this product? In every state with a medical cannabis program, there is a process to becoming a medical patient. This details how to become a medical patient in Maryland. Most states are pretty similar. So you would go to the state website, which I have listed here. In Maryland, there's 2 steps. Some states just have 1 step that's kind of all this combined. So just be aware of that, and you can certainly reach out to me with questions about your specific state. But with the state of Maryland, you go to the state portal and you register. You have to give them your social security number, a copy of your photo ID, and prove that you live in the state of Maryland with some sort of proof of residency. There's a $25 fee for this, and your registration with the state is good for a very long time. I believe it's good for 6 years now. You do have to wait for the state to send you an approval email. But once they've sent this approval email saying, we've looked at your information, we have confirmed that you are a resident of our state, then you can take that email that you received from the state and you can go to a certified medical professional who does annual certifications. And then a certification in every state that I am aware of is an annual process. So you would have to go to this medical professional each year to renew your medical card. And then once you have done that, then you can shop at a dispensary. Some people may not want to go through the process of paying to become a medical patient. They may, if you have access to adult use 21 plus recreational cannabis in your state, you can go through that format as well. And so this is where I think it's important to talk about what are the differences between medical cannabis and adult use cannabis. Generally speaking, these products are exactly the same. The products are not different, though there may be some product differences with high dose products. So almost every state has a different limit for the number of the milligrams of THC that can be in an edible in the medical program versus the adult use program. And there is always a difference in the taxes that you pay as a medical person compared to an adult use person. In all states, the medical tax is either zero, or in Maryland, it's zero, or it's low. And then the adult use tax is higher. In Maryland, our adult use tax is 9%. So if you don't want to pay that 9% cannabis tax, the medical card would be the way that you would want to go. Some states like California have different areas throughout the state where the tax does vary, but it can be as much as 30 to 35%. So I can help you kind of see what the landscape looks like in the state that you're in if you have access to both programs, so that you can kind of weigh what you think your best option may be. And you can always, if you have access to adult use, you can always shop as an adult use consumer first, kind of feel out what the whole environment is like and the types of products, and then maybe talking to the dispensary's clinical director, kind of determine if it might be worth your while to shop through the medical program. Though you will always save money if you are shopping going through the medical program because you're saving on the taxes. So it's a very individual decision. Almost every state has a list of state-approved dispensaries. The MCA in Maryland has one. And like I mentioned before, state licenses will be displayed in the lobby or waiting area of almost all states. And the reason that this is important is I want to close on one final kind of consumer safety issue to be aware of. There are products out there that are hemp-derived that are known as Delta-8 THC. And I just want to start this with saying I love the hemp-derived CBD market. There are a lot of really amazing products out there. Specifically, Delta-8 THC is a consumer safety issue because these products they have psychoactive effects. They have a very similar effect to Delta-9 THC. So these are psychoactive products that are being sold that do not have oversight by your state's regulatory body for medical or adult use cannabis. And because we all know that federally cannabis is still illegal, although they're doing the descheduling or the rescheduling thing right now, but it's still not going to fix this issue. There is no federal oversight of Delta-8 THC products. So what this means is that you may see in gas stations, convenience stores, smoke shops, or what people may refer to as head shops sometimes, you may see products that look a lot like adult use cannabis products or medical cannabis products. But these are not licensed dispensaries in your state. These are not products that have been tested for potencies, for heavy metals, for microbials. And so it's very important when we were talking about what questions to ask your bud tender. When you're asking those questions, you're determining, am I in a state legal licensed dispensary in my state, or might I accidentally be at one of these smoke shops? And these products are Delta-8. Be aware that Delta-8 is not the only isomer of THC that exists with these products. There's other ones like Delta-10, THC-0, and some other ones that I have listed there. And I know that those are kind of a lot of acronyms and it sounds a little confusing, but I promise you that if you use the questions to ask your bud tender, you can be confident in knowing whether or not you are in a licensed dispensary that has regulated and tested products, or whether you might be in another type of store that may have some of these kind of untested Delta-8 products. So that's why I want to close on this and just kind of say, please be cautious. You may be in a state that doesn't have any medical cannabis program or adult use cannabis program, and Delta-8 may be your only options. I would still say, please be cautious because these are not tested. And so a lot of the consumer safety issue that a lot of doctors who aren't familiar with state legal cannabis programs that they bring up, concerns about testing, concerns about cross-contamination and molds and funguses and stuff like that, all of that is true for Delta-8 products. So that's why I like to kind of close with that. Just remember your questions to ask your bud tender, and really make sure that you have a good and engaging dialogue there, and then you can be confident about where you are shopping. So I know that these slides are also going to be made available to everyone in attendance. So I do on this slide here have some additional resources for you. If you're in Maryland and want to become a patient, there's a link to the patient portal. There is an MCA approved dispensary list where you can be confident finding a dispensary in your area that is licensed by the state. And then some just general information about what are cannabinoids that we talked about here today, and a little bit more information about common conditions that can be used to help, or that can be helped with cannabis. And so with that, this is my final slide. I'll leave this up as we go into the question and answers period, so that if you want to take down my email and reach out to me after the fact, you are welcome to as well. And
Thank you very much, Tracy. And we'll take a quick few minutes here for questions and answers. I am going to ask Faith, who is here, or Irene, who has raised her hand, to allow her to come in and ask her question.
Hello.
Yes.
Hi, this is Irene. I didn't raise my hand on purpose, but I do have a question.
Okay, good.
Since this is a transplant seminar, is the overall understanding, and I know every case is different, but that it's safe for transplant people, or is this just in general and doesn't have anything to do with transplant?
So that's a really great question. I know that the world of transplants is really complex. So to say across the board, yes, right for everybody, we just can't say that. It is so individual based on your medical history. And so I know that there are a lot of symptoms and different kind of conditions that may be related to or just in addition to in the transplant community. Which is why I tried to list some of the things in that first slide there that cannabis may be able to help with. So I think that starting a conversation with a medical professional is important. And I know within the transplant community that there are doctors that are not receptive to cannabis. And so if you're seeking a second opinion, I can help to connect you with individuals who are knowledgeable about cannabis and are knowledgeable about, how it would interact specifically, with your particular conditions. And I know that there are many people in the TRIO community who are medical cannabis patients who it has really helped them in their journey with many different aspects. So that's why we can't say, across the board, yes, definitely everybody, no matter what. And that's why we'll really go into some of the specifics about your medical history.
Okay, thank you.
Thank you.
Yeah, thank you. Let's see. I'm going to go to the Q&A, and Bobby has a question about how do you start the conversation with your doctor about interest in medical cannabis, preferring oral options.
Mm-hmm. That's a really good question. I think that it depends a little bit on what your relationship is with that current doctor. Have you been seeing them for a while? How familiar are you with them? Because I understand that it can be a kind of nerve-wracking conversation to have. And if they, dismiss it outright, that can cause some issues. And so what I would say is like, if you feel that you have a good rapport with your provider, letting them know that like you've heard about X, maybe it's something specific about like this condition that you know as my doctor that I have. I've heard that it might be able to be helped with medical cannabis, or like I've heard that this particular cannabinoid might be able to help with it, you know, based on some of the information that we talked about here. And asking them, what's your perspective? I think a lot of doctors today are very open about if they don't have the knowledge about cannabis themselves. Many doctors now are saying, you know, I don't personally know, so I don't feel comfortable recommending something to you that I don't know much about. And that's where using some of the resources like I've offered, where I could connect you with medical professionals who do have that knowledge, have kind of done that. That can be kind of a good place to start if that is the response from, you know, the doctor that you're working with.
Thank you, Tracy. I don't see any other questions at the moment. I went ahead and opened your slides and dropped the links in the chat. So if anybody wanted to grab those now, they are there. And if we don't have anything else, I want to just thank you for being here today. And to close out today's session, we are going to hear Marty Marin again.
Thank you for joining us today for Trio Maryland's third virtual transplant conference. We hope it provided the information you need to make informed decisions and to lead a healthy transplant life. I'd like to express our gratitude to the Trio Maryland Board of Directors, Ashton Conference Planning Professionals, and DRIO. Also, I would like to thank our partners, Infinite Legacy, Johns Hopkins Hospital, and the University of Maryland Medical Center. Thanks to our speakers for sharing their expertise with us. Thank you to the sponsors that continue to support Trio Maryland and all our educational efforts. Trio National, the National Kidney Foundation of Maryland and Delaware, CareDx, Anatomy Gifts Registry, Peak Relief, and the Infinite Legacy. Don't forget to check out our sponsors' website for more details and information. All sessions have been recorded and will be available to view on the Trio Maryland YouTube channel. An email notice will be sent out to you when it is available. Check out our website at www.triomaryland.org to review our calendar for upcoming speakers. Follow us and like us on Facebook and Twitter. I post current transplant information daily, so don't miss out. Check out our YouTube channel for our past presentations. And once again, thank you all again, and thanks for starting your day with us. Have a great weekend.